RSV season is ramping up, and doctors are hoping a new shot to prevent the virus eases cases after last year's record. RSV is the leading cause of hospital admissions in children under the age of 1. As Natalie Brand reports, the new shot could possibly change that.
And this is our daughter's nursery.
Molly Fleener is due in December. Her second daughter will be born during the peak of RSV season.
RSV can be very scary. It can take a turn really quickly.
This new Beyfortus RSV antibody shot is bringing hope. It helps prevent the virus in babies from birth to 8 months or in older babies with severe risk factors.
Hey, am I going to get a smile from you?
But some pediatricians are facing challenges getting supply. Dr. Lauren Fitzpatrick is with Luminous Health Anne Arundel Medical Center in Maryland.
There was not an infrastructure in place to roll out monoclonal antibodies, and so even though we have families that are requesting it, we can't meet their demands.
A big complication right now, the cost at nearly $500 a dose. While the shot is expected to be covered by most insurance plans, providers need to order the shot before knowing how much they'll be reimbursed.
Given what you saw last year, how frustrating is this?
Oh, we're angry. As pediatricians, we're angry because it feels like we have an opportunity that may be missed.
This summer, the American Academy of Pediatrics urged federal leaders to provide support so the shots can be administered widely and equitably.
It shouldn't be a guessing game. It should be pretty black and white and should be accessible and available to as many people possible, if not everybody.
Molly Fleener will also be eligible for the new RSV vaccine for pregnant women. Doctors are recommending either that shot for mom or the immunization for the newborn. Fleener is deciding between the two, but knows she wants the protection.
The American Academy of Pediatrics is recommending that every baby whose mother did not get the maternal shot receive Beyfortus in their first week of life. The CDC says infants, young children, and older adults are at increased risk of a severe RSV infection, and they say almost all children will have had an RSV infection by their second birthday. Symptoms in RSV include runny nose, decrease in appetite, coughing, sneezing, fever, and wheezing. If you or your child is having difficulty breathing, not drinking enough fluids, or has worsening symptoms, please call your doctor. Now, when it comes to protecting yourself from viruses, health experts say vaccines are your best option to prevent illness or make your symptoms less severe. As of April of this year, 68% of North Carolinians had gotten at least one COVID shot, and 100% of folks 65 and up got their vaccine and completed the 2-dose series. But with this year's fall and winter respiratory virus nearing, new data shows many Americans are not planning to protect themselves with the updated COVID booster or the flu shot. Bradley Blackburn tells us why health officials hope everyone rolls up their sleeves.
With COVID-19, flu, and RSV circulating in the coming weeks and months, top public health experts are spreading the word. Vaccines are safe, effective, and protect against serious illness. Dr. Mandy Cohen is the director of the CDC.
We're going to keep monitoring to understand how bad this particular season will be, but we can act now with tools to make this season more mild if we all get vaccinated.
A new survey from the National Foundation for Infectious Diseases shows while 65% of adults know vaccination is the best way to prevent flu hospitalizations and deaths, 43% do not plan to or are not sure they will get vaccinated. Only 40% plan to get the new updated COVID-19 vaccine and the RSV shot if they are over 60.
28% of U.S. adults who are at higher risk for flu-related complications said they were not planning to get vaccinated this season. To us in this business, that is worrisome.
Last flu season was moderately severe. Activity levels returned to pre-pandemic levels. There were 31 million illnesses, 360,000 hospitalizations, and 21,000 deaths. 176 pediatric deaths were also associated with flu, the third largest number since reporting began nearly 20 years ago.
More than 80% of those were not fully vaccinated against flu. We want all of our kids to be protected.
The CDC reminds that receiving multiple vaccines at one time is safe and effective, giving you multiple shots at protection.
And data shows last season flu vaccines reduced hospitalizations and deaths among adults by nearly half and by 3/4 among children. While experts are urging you to get the shot, some people are saying insurance is making it hard.
Pharmacies are already seeing a lot of interest in the new updated COVID-19 vaccines, but one viewer told us she got turned away over the weekend. She said the pharmacist told her that Medicare was not covering the shots, but she could try again in a couple of weeks. So let's verify. Does Medicare cover the new COVID vaccines? We checked with these sources to find an answer. Medicare.gov says the COVID vaccine is one of the preventative services covered by Part B, and the administrator of the Center for Medicare and Medicaid Services sent a letter in July to Medicare plans, private insurance companies, and state agencies saying that government plans and most private plans must pay for authorized vaccines. So we can verify, yes, Medicare does cover the new COVID shots. A CVS spokesperson told our Verify team some insurance providers are still updating their systems and might not be ready to cover the new shots, even though they're available in some pharmacies now. Its pharmacists can help patients schedule new appointments, and Walgreens says shots can be covered either by insurance or by government assistance programs.
So why even get the new shot? This new vaccine is a little different than the last one in fact that it targets only the latest variant of the virus instead of several different variants. Large chains like CVS Pharmacy already started administering vaccines. But as the pandemic falls further and further in the rearview mirror, interest in the new shot seemed to be waning compared to previous vaccines that were offered during the height of the pandemic.
Demand's not been as high as it was, but we do have a lot of folks that are calling and asking or coming in saying, hey, my doctor's recommending that I go ahead and get this with the flu shot, so that way we get them both taken care of. So I would say the demand is there, like I said, especially in those older individuals.
Most insurance plans will cover the new vaccine at no cost to you, and the CDC's Bridge Access program is an option for families without health insurance. Meantime, the U.S. is sending out COVID-19 tests to Americans for free again. Health leaders relaunched the program last month, allowing families to get 4 kits per household. We've got the link to place your order up on our website. Just search free COVID test. If you still have some unused tests from the last time around, the FDA recommends checking the expiration date. Several brands have extended their dates, which means some expired tests are still good to use. And as we go to break, we want to bring you a happy moment created in part by the health crisis we fought over the past 3 years. Drew Westman is a physician and scientist who won the 2023 Nobel Prize in Medicine. He and his research partner were recognized for their discoveries contributing to the development of mRNA vaccines against COVID-19. Hear his call to his parents to tell them the good news.
Hello?
Hello?
Hi, it's your son.
No kidding.
Yeah. Rachel.
How you doing, honey?
Good. Rachel's also on the phone. Is Dad around?
Yeah, he's on the phone.
Oh, I have some news.
Shoot.
You're both on?
You there, Hal? Yeah.
I won the Nobel Prize.
Oh, you're kidding. Oh, my God. Congratulations. Oh, how fabulous. I don't know what to say. I'm ready to fall on the floor. It seemed you kept saying, no, it's never going to happen. And you did it, and so young.
Yep.
Congratulations, sweetheart. You're the product of our hearts, Drew.
Thank you.
Congratulations, and you deserve it.